So let's begin. Uh, Hello, everyone, and a very warm welcome to the second speaker session of the month, organized by Rethinking Economics GNU. The theme for this month is behavioral economics, and we are thrilled to have with us today Dr. Pavan Mamidi, who will share with us some insights on the significance of behavioral research in the development sector in the context of the COVID-19 pandemic. As some of you must know, Dr. Sayan Kundu was also supposed to join us today. Unfortunately, he is unwell and unable to join us. We will hope to have him in the future and we wish a speedy recovery. I will briefly introduce the speaker before we begin with the session. Dr. Pavan Mamidi is the director of the Center of Social and Behavioural Change at Ashoka University. Besides this, he also provides policy-based consultations to ministries such as the Human Resource, Health and Finance in Delhi and governments in Bihar and UP. Presently, he is working with Niti Aayog in order to set up a Behavioral Insights Unit for India, also known as a Nudge Unit. His research in behavioral economics include analyzing social norms, pro-social behavior, and behavioral ethics through lab experiments. The session will focus on understanding the role of research in behavioral economics in the development policy space, especially in the context of the COVID-19 pandemic. The session will be mostly interactive, so feel free to drop your comments, share your thoughts in the chat box. So without further delay, I will pass the mic to Pavan, sir.
Thank you very much. I hope you can hear me clearly.
Yeah.
At the very
Yes.
outset, I do indeed wish Sayan Kundu a speedy recovery. I know him a little bit, and so we will be missing him, but I'm sure you will get an opportunity to get him back. Um, but I'm delighted to be here today, especially because it is JNU, and JNU is one of my favorite institutions in this entire world. Although I come from Ashoka University, which is supposed to be the first liberal arts university in the country, I do genuinely believe that JNU can also make a claim that it is indeed the first liberal arts university in the country. I have several fond memories of the time that I spent at JNU, and I have been an informal student of JNU. Which I dare say is in some ways better than being a formal student of JNU. So, and I do think the JNU is a state of mind, and I'm proud to be its informal alumni. So thank you very much for having me. And I'd like to start off by placing before you a couple of ideas, um, a couple of issues that we are working on, and the structure of my organization and how we are contributing to a variety of policy causes in the country. So CSBC was started as an initiative by Ashoka University, out of Ashoka University, but it was very generously supported by the Bill and Melinda Gates Foundation. So it really started off with an ambition to start the first behavioral insights unit, or rather a nudge unit in the country, and BMGF for a very long time has had this ambition, and for a variety of reasons they decided that they should seed this out of Ashoka University at the beginning. So we were founded in 2017, and some of our founders include Archana Vyas from BMGF, Pramod Sinha, the great institution builder from Ashoka University, and so on. More recently, we struck a relationship, and you might wonder, well, how is this important from a behavioral science point of view? But I do believe that these structures are also important in terms of how knowledge is produced and how knowledge is implemented on the ground. So we have a relationship, a tripartite relationship. On one hand, with Niti Aayog, then you have Ashoka University, and you have BMGF, and all the three bring their own unique elements into this project. So the government, of course, brings in the problem statements, whether it is in health or whether it is in financial inclusion or gender. The government gives us the context. It specifies the problem. BMGF, of course, gives us the resources to do the empirical research. Empirical research is not costless. It costs a lot of money, and we need people, we need data. And so BMGF provides us that initial resource. But not only that, it also gives us tremendous social capital, right? And of course, Ashoka University is a vibrant young university. It's a brilliant university, and it gives us the intellectual firepower. So all the three together, in some sense, animate this project of the behavioral movement in India, at least the way it has been conceived. The inspiration to start this, of course, is the nudge unit. And I'm sure most of you know what the nudge unit has been in the UK, at least. It was started initially as a body embedded within the government. It's called the Behavioral Insights Team. They've been doing brilliant work. They have some really cool experiments that they ran, and they've contributed immensely. But this work in itself was inspired by the seminal book written by Cass Sunstein and Richard Taylor. Sunstein is, by the way, one of our primary advisors and a deep friend of CSBC. So that book really became popular. I mean, it captured the imagination of the public. It captured the imagination of policymakers, and people started wondering, how do we start adopting, adopting the insights presented in that book in solving problems, real world problems. And that's how the first behavioral insights team was started in the UK with the government. And that, of course, inspired us, and that's how we came to be. Now, in terms of the problem areas that we work on, health is one of our big areas. So within health, for instance, we've been working on, just to give you a flavor of the kinds of projects that we work on. We've been working on how do you get doctors to be more efficient in promoting HPV vaccine among families with young women, for instance. HPV vaccine is basically a vaccine meant to prevent cervical cancer, and it relates to reproductive health of young women. It's a taboo subject. So how do you even get this conversation started with a family? It's not an easy thing. I mean, you might think it's easy, but get a doctor to start talking about the sexuality of a youngster in the house, it becomes very, very problematic. So we've done that work in the state of West Bengal. That's a project that was funded by the American Cancer Society, and we tried a bunch of interventions, and then we ran some experiments to see what works and what doesn't work. And we have some interesting results, which I'm happy to share with you offline. Some of the projects that were given to us by Niti Aayog, for instance, include this really important problem statement, which is, how do you increase, or rather improve, complementary feeding for children who are between the ages of 6 months and 23 months. Until 6 months, they're obviously on breastfeeding, and but after 6 months, you are expected to get kids onto a diverse diet, a diet that is comprised of multiple types of food and so on. Now, the challenge is, how do you get that? How do you get families to go past providing their children with this very liquidy lack of nutrition dal rice that they give children, right? How do you get them to do that? It's a very important problem. And on child nutrition front, we are rather behind, and therefore that's one of the problem statements that came to us. Then the other big problem statement that we have been working on is anemia. How do you reduce anemia? And one of the and a specific problem related to that is, how do you get pregnant women, for instance, to increase their intake of iron pills, because iron basically helps overcome anemia. So how do you, for instance, get people to not forget taking pills? It might seem like a trivial problem, but it is not a trivial problem, right? So one of the inventions that we came up with, and this is at the time that we partnered with another organization called Busara, we experimented with calendars. We would give out calendars with little scratch squares, which would reveal the picture of a an attractive looking baby, right? And basically to provide a micro incentive to get people to scratch off and then be reminded that they need to take a pill and so on. So, and we found that it substantially increases the rate of taking the rate of consumption of iron pills, right? So we work on these kinds of problems within the health space. And of course, over the last year and a half, we've spent a lot of time working on COVID-related issues. The mask campaign that we did, which was based on social norms. The more recent work that we've been doing on vaccine hesitancy, overcoming vaccine hesitancy in Bihar. We are reaching as many as 10 million women. We work with this absolutely amazing organization called Jivika. And of course, BMGF has been there in the background. In Bihar, we've been working with this other outstanding on-the-field organization, which is PCI. So we don't work in isolation. We work with a variety of stakeholders on the ground. A lot of them teach us stuff. Teaches us stuff. BMGF teaches us stuff. So we learn from others. But we also bring in our own sort of unique competence into addressing these problems. So what is it that really ties us down? On one hand, we seem to be agnostic to the kinds of problems that we deal with, but what is the unifying thing about CSBC? And that's where we come to the specific research methods that we use. So the first thing that I would say is we use behavioral experiments, right? I'm sure you're familiar with behavioral experiments from your behavioral economics classes. A lot of knowledge in behavioral economics has been produced experimentally. And an experiment is sort of uh, an event that you undertake with a view to teasing out the causal relationship between one variable and another variable, right? So experiments are good at bringing out causal relationships, and that's exactly what we do. So we have a mobile lab. We used to have a bus, which we could drive and plant anywhere in the country, and then get subjects into the bus, and then we could run experiments. You could go and park yourself in a sugarcane plantation, or you can go park yourself in a rural village in Madhya Pradesh and then run experiments. So we have abandoned the bus. Now we propose to use little tents when we sort of organize these experiments and so on. So the mobile lab, the ability to run experiments in the field, experiments which would otherwise be run only in universities and classrooms, we can run them in the field. That's the thing that really unifies us. But it's not just experimental methods that we use. We also use qualitative methods, because before we even begin to design interventions that can potentially change something on the ground, we need to understand what are the barriers to change. We need to understand why are people doing what they're doing, right? So, and that requires us to go into the field and have many conversations with different stakeholders and understand their issues, embed ourselves there almost ethnographically, and then learn, and then come back and invent those interventions. So these are the two things. It's the research methods, it's the hard empirics that unifies who we are, right? And that's the sort of the one of the key things that comes up. More recently, and I will pause after this. More recently, we have been working on the use of narratives. Um, I'm sure all of you have heard of this wonderful work done by Bob Schiller on the economics of narratives, how narratives have a tremendous impact on human behavior. What are narratives? Narratives are essentially stories that we tell each other, and how stories are behavioral mechanisms by which we can change behavior. And sometimes narratives play a far more powerful role than do rational means. So we enjoy, we are very excited about the opportunity of using stories to change behavior. And we've started creating videos, and we are interested in films, we're interested in music and how stories are told using folk music, etc., and how that can change behavior. So let me pause there, and then maybe we can take some of the questions that come from your side, and we can take the conversation forward on the basis of how you want to take it.
Yes, thank you, sir. So there have been some questions from the team itself.
Okay.
And so I'll start by asking, and I think you have touched upon this, but still, if you have anything other to add. So the first question is, how behavioral science can be applied in policy, and how far does our present policies incorporate the behavioral aspects of human
So,
in the
okay,
Indian context?
that is one of the central questions of starting a nudge unit or starting a behavioral insight. So how does behavior science? What is the role of behavior science in policy? So policy has a bunch of levers at its disposal in changing in addressing human behavior. It's not always to change behavior. Sometimes you want to preserve certain types of behavior, right? It's not always to change behavior. The most, I think, important lever that policy uses is institutions, the legal system, right? Formal institutions. And what are formal institutions? If I were to borrow a very crude way of describing an institution, I would see an institution as essentially an expected cost that the system imposes on prescribed behavior. This is almost a Gary Becker kind of a view of what an institution is, what a law is, right? So if somebody breaks a law, you basically impose a fine on the person, and it's the disincentive of that fine that changes the person's behavior. So institutions are very, very powerful ways of governing human behavior. So that's the first instrument available um, in the world of policy. The second big lever that policy can use is the markets. Why? Because markets involve prices, and prices also guide behavior in some sense, right? So that's the second big lever. And there are a variety of ways in which I think the government deals with policy, deals with markets with a view to changing behavior. The third one would be informal institutions, and by this I don't mean, and by this I mean social norms. Social norms are essentially informal institutions, and they are ways in which the expected costs are imposed not by the government, but they're imposed by your neighbors, your family, and so on. Right now, governments are beginning to increasingly shape social norms in society deliberately, right? One would have thought that social norms just evolve and hang out there in society, but social norms can also be proactively and very willingly created, and governments can get into that process. So that's one way that governments can change behavior. And the fourth one that I would throw into the mix is the whole business of nudges, which is to shape the choice architecture of individuals with a view to changing their behavior, or with a view to facilitating a certain type of a behavior which is good for, ostensibly good for the people. So these are the different levers. Now, in outlining these different ways in which policy and the government can influence behavior, what is the relative role of behavior science as compared to legal institutions? I dare say it's very small, right? I mean, there are people who would have you believe that it's a very, very small increment that behavior science can actually um, produce in the incremental change that behavior science can produce, and so on. The real weightlifting is done by institutions. But having said that, I do still think that behavior science has a very distinct and an important role to play in society, right? So it's not the only lever that is available to policy. It's important to see it as one of the multiple tools that are available, right? So merely creating a nudge unit or creating a behavioral insights unit is not going to change society completely. You need all these other ways in which you can change society. I don't know if I have answered your question sufficiently, but let me pause there and maybe I can take more questions. Yeah.
Yes, sir. So the next question is, the pandemic has forced us to adapt to significant behavioral changes within a very short span of time. How can behavioral science aid governments in framing strategies to influence community behavior, like mask wearing, vaccination during pandemic, etc.?
You're quite right. So the pandemic has been a bit of it has been a tsunami, right? I mean, it has forced us to do things that we would never imagine that we would be doing, right? Not socializing. Our instinct is to spend time with loved ones or spend time with other human beings. Um, and then suddenly we find ourselves in a situation where the norm is now to be away from each other, right? So it's almost a sort of an antisocial kind of a new norm that has uh, come into society. Now, how do you how do you change behavior to facilitate healthier lives is the key question. And there are two or three things that have been done. The first one, of course, relates to mask wearing. In the initial stages, of course, when the pandemic first hit, people were still ambivalent about the usage of masks. I remember a time when the World Health Organization was trying to tell us that masks are not really useful because they don't really prevent um, a disease from the acquisition of a disease. But subsequently, people then learned that a mask can be very effective in the prevention of the transmission of a disease, right? And all of you are economic students. If you were to peruse the famous Coase theorem, uh, the onus of responsibility should be on those for whom it is the least cost to avoid a negative externality, right? So wearing a mask is precisely that. It's almost negligible cost. Well, there are some, of course, costs of discomfort and so on, but when you wear a mask, you actually help somebody else from acquiring acquiring the disease. Now, how do you bring that norm of wearing masks into a society where, for instance, you have to operate with certain other pre-existing norms? Whenever you want to bring in a new norm, you need to overcome pre-existing norms. One of the biggest norms that we experience in our society in particular are norms relating to fatalism. I'm sure all of you are aware of the concept of fatalism, this idea that there's nothing that we can do to change our future. The future is already written out there, right? And so what's the point in hurrying through life trying to do this and that and change it because it's already written out? It's an extreme form of teleological determinism that sort of pervades society. I mean, you go to a local village, I mean, that's what people will say, whatever is going to happen is going to happen. You can't do anything about it. But so how do you break past fatalism to get people to wear masks? That is a problem statement. That's a very, very important problem statement, right? The same with vaccine hesitancy. I mean, we don't have very good empirics about the different types of vaccine hesitancy and so on as we speak, but it indeed is a problem that needs to be addressed. And vaccine hesitancy can also arise out of the very same type of an impediment that we witness in the case of masks, which is some kind of fatalism, or it could be false information that vaccines are bad for your health and so on, right? I mean, there's a lot of crazy information out there about what vaccines do to you and or not do to you and so on. So how do you help people get past bad information and make the right choices? Are two sort of key challenges that behavioral science has been attempting to address during the pandemic, somewhat successfully and in some regards very unsuccessfully. But we're trying. We're trying. Let me put it that way. Let me pause there.
Thank you, sir. So the next question is, people in South Korea are more willing to mask up than in the US. One of the reasons for this difference in behavior could be culture to study such variations. Could be culture. How should behavioral economics engage with the study of culture to study such variations? How do you think this should lead to a change in economics curriculum with respect to disciplines like anthropology?
Great question. Well, first of all, studying culture is difficult business, right? I mean, first of all, I don't even know if we have a common acceptable definition of what culture is. There are a variety of people who will define it in different ways. At least there is lesser confusion about what economics is, and therefore, I suppose people are more successful in creating economics programs than programs in culture. Well, no, but that's a in a lighter vein. But in terms of the observation that some societies people tend to be more obedient than certain other societies, I think I don't have hard empirical data to say that it is true, but I would conjecture that it is true, right? Um, it is conceivable that when people are more obedient, more trusting of their institutions, that they will actually comply with what is expected of them by the government. But the US is an intensely libertarian society where individualism is the sort of the credo of the nation, right? I mean, the foundation of that country is based on exploration. It's based on the idea that individual rights supersede community rights and so on and so forth, right? So in such a situation, people have actually taken it, taken it to their heart, so much so that they refuse to wear masks because they think that it's an affront to their personal liberty. But this is where the big question arises, and that is your personal liberty can be diluted in some measure insofar as it impacts the lives of somebody the life of somebody else, and that's a sort of a sort of an ongoing debate within the sort of the American cultural ethos, cultural legal ethos, right? um, now the question, so there are interesting consequences of these two different types of societies which tend to be more authoritarian, where behavior is more subservient, behavior is more based on obedience, etc., are likely to be good on these occasions when you need to get people to wear masks in the face of a pandemic. But are these societies as creative as societies which are completely free, where getting people to wear masks may not be all that easy? So there are pros and cons of these two different types of cultures, as it were, right? Now, in terms of how do you get economics to benefit from the value of anthropology or the value of culture, I think I think a lot of disservice has been done in the way economics programs, graduate programs in economics have been structured over the last 50 years. I mean, the neoclassical revolution in economics um, has construed of human behavior as being akin to those of automatons, right? And the pure rational choice approach to thinking of human behavior, I think, has been found to be deeply flawed by the behavioral revolution. And progressively, what has happened is people have begun to recognize that economics, it's not sufficient to sort of construct economics based on these very stringent mathematical principles, such as, for instance, the principle of transitivity, which need not be obeyed by real people in the real world. I think graduate students in economics need to be exposed to courses in sociology and social psychology. They need to be exposed to work in anthropology. They need to be given tools of qualitative research. They need to be encouraged to go and have conversations with people, and that the answers to social sciences, to questions in social sciences, are not to be found within the realm of mathematical equations, but in actually getting empirical data by going out into society and interact. Economics is a social science, right? So that, I mean, we seem to have forgotten that, and we seem to have sort of become deep mathematical theory builders, which I think has run its course. Yeah, let me stop there.
Thank you. So that's so true. There's this next question in the question and answer box. Someone asked that during the COVID-19 pandemic, we have seen the hoarding of medical resources by certain consumers in anticipation that they might need those in case of a future emergency. And this in turn imposes a negative externality on society. How can we use behavioral insights, example using narratives, to influence people's reaction in this scenario so as to prevent them from reducing the supply of essential items in the market when they don't need them? Has there been any research on this so far?
Great question. So it's not an easy problem to solve. Yeah. Yeah. So as I was saying, I mean, we're all too familiar with pictures of supermarkets which have, where people have bought out all the toilet paper and, bought out all the dal and rice and so on and so forth, right? I mean, I know several of my own family members who have, in a way, succumbed to this temptation to sort of prepare for the worst and so on. So let's try and generalize in some sense. Why do people do this? I mean, you can sort of view it as a form of rational behavior, right? I mean, short run, privately rational behavior. Because if run there and if I jump the line, if I collect, if I hold all those things, I'm I'm basically saving for my family, and that is useful to me because in the event of a really bad situation, I have food to eat, and that's a basic human instinct to her or to hoard. And you can't really hold people in some sense morally accountable during stressful times and so on. I mean, we need to also be somewhat kind in the way we interpret this behavior. This kind of behavior is not uncommon. It's a form of non-cooperative behavior. It's privately rational, but it's non-cooperative, right? And this species of behavior is studied by the use of these games called public goods games in experimental economics. I don't know if you're familiar with that. I'm sure your outstanding teacher would have taught you this. A public goods game is where a bunch of people have to contribute to a common pot. The experimenter multiplies it and redistributes it equally among all the members and so on, right? In the initial stages of the game, in the first few rounds, people contribute higher amounts, right, to this pot. But progressively, they start believing that, I can contribute less and still make a highish amount, and therefore they start progressively contributing lesser in this game. If you were to map the average amounts that they contribute with the number of times that you play this game, that you repeat this game, it progressively degenerates. So it's a breakdown of cooperation, right? So the breakdown of cooperation is quite a common phenomenon. When people are left with their own sort of private immediate sense of rationality, that's what people do, and they can't coordinate and they can't sustain cooperation for too long, and there's a decay of cooperation. It's a sort of almost an inverse exponential kind of a relationship between the number of times you play the game and the average amounts that they contribute. Now, there was a very nice experiment run by these two economists, Fear and Gachter, Ernst Fear and Simon Gachter. Fear is at Zurich, and what they basically did was they included a condition, and that condition was you could now see what the other participants have contributed, and you could punish somebody who was not contributing to the pot, right? If you thought that they were behaving badly and so on. And as soon as people started punishing each other, and there was another very interesting condition that they imposed in the structure of the game, in the way that you could punish somebody else, it would cost you a certain amount of money to punish somebody else. If I were to punish you by decreasing your endowment by 4 rupees, it would cost me 2 rupees and so on, right? They did that. And guess what? Cooperative behavior picked up again, indicating that at a very fundamental level, you need some mechanism. If you remember, I earlier said an institution is really an expected cost for bad behavior. If you could, the Fear and Gachter experiment demonstrates that the moment you allow people to punish each other for bad behavior, cooperation comes up again. So now let's try and take the learnings of this experiment to what you raised, the question about people hoarding stuff. People hoarding stuff is bad behavior. So is there a social norm that we can create in society which punishes such people for engaging in such behavior? Can we do that? Is there a way of doing that? I mean, operationalizing this is going to be a bit of a challenge, but certainly it's a direction. Can we then now, at least now we know that if we can create an informal norm where if we notice our friends or family members engaging in this behavior, we look down upon them or we shame them in some social way, right? That might have some kind of an ameliorative effect in hoarding, in the sort of behavior that you talked about. That is one immediate sort of idea that comes to my mind. But of course, you can also think of the use of narratives. So how do you use narratives? Maybe you can build a powerful story about how some families which were left behind, who could not get vital medicines, for instance, or vital, food to eat. I mean, with little kids and so on, and how it has led to suffering among people. And you make those things salient, you might actually be able to change behavior. You could, right? But the thing is, you need to design that campaign. You need to design that communications campaign aided by these very powerful stories. A story is a very, very powerful instrument. There's this wonderful study by Abhijit Banerjee, how edutainment was used in changing reproductive behaviors in Africa, right? So narratives have a very, very powerful. So you could use those to change behavior, right? But you need to sort of sit down, design those narratives, create those movies, create those short clips. And in this day and age, when people's attentions are deeply fragmented, I mean, we are talking about a TikTok age, right? A person's attention span is less than 15 seconds. So within those 15 seconds, how do you nail that little message which tells people that they need to change their behavior? That is the challenge, right? So sadly, we don't have answers to all these questions, but at least we have some directions on how to do that kind of stuff. And that's exactly what we at CSBC are attempting to do. Let me pause there and then maybe take another question.
Thank you, sir. So now Alias asks, has there been research on the effect which COVID had on the treatment of other diseases? For instance, TB, cholera, and malaria uh, were significant causes of death in Delhi pre-COVID. Such patterns are unlikely to change so quickly, but virtually all of India's healthcare force has been focused upon COVID. And the second question he asks is that what are some of the ethical constraints and challenges which one faces in behavioral research, and how does one deal with them?
Okay. First question. Do we have any evidence? Sadly, not. Well, we have some evidence, but not very good evidence. So if there's anything that we need in this country, it is good evidence. We need high quality survey data that can, even for instance, take for instance uh, the the conversation that we were having about vaccine hesitancy. Do we really know what are the different drivers of vaccine hesitancy? We can draw some conjectures, but can we associate those different sort of types of barriers or those different types of hesitancies to different segments of society? I don't think so. We don't have that granulated data. So we really don't have I don't know if you have high value data which can speak to the specific question as to how focusing all our attention on COVID has left to a neglect of other types of health problems. And I'm pretty sure that the other health services have been dramatically and adversely impacted. There's no question about it, because we have finite resources. The finite resources are being dedicated to solving only one kind of a problem. So my conjecture is yes. I mean, there is some anecdotal information about how people suffering different kinds of things have actually, suffered on account of COVID and so on, right? The second question I think is an equally important question, which is the ethics of using behavioral science. There is a very, very deep ethical question here, and that is the following. When you use behavioral science, when you use a nudge, it is likely to succeed more effectively if the person that you're nudging is unaware of the nudge, right? In other words, if you are able to use a modicum of deception, you're able to nudge the person's behavior better than I dare say than when the person is aware of the fact that he or she is being nudged, right? I mean, full information, you're aware of it, and therefore you might make a deliberate choice not to be nudged, and so on, right? So now the question is, if we are likely to be engaging in a certain amount of deception in changing people's behavior, the question then becomes, Are we compromising on the autonomy of the individual whose behavior we have changed, right? Now, because because there is a likelihood that we have compromised on the autonomy of the other individual, we have caused a little diminution of their welfare, right? We may place them in a happier position, but you also need to subtract the diminution in the welfare or in the utility um, caused by the fact that their autonomy has been compromised. Now, if in fact the amount of autonomy that you have compromised, if the loss of utility caused by the amount of autonomy that you have diluted is very high, then then this whole ethicality of nudging then becomes very doubtful, right? So now here is the question then, so how do we ensure that people who are engaging in this whole business of nudging and the use of behavior science are not causing a loss of welfare in society by compromising on the autonomy of individuals? That is a very fundamental question. Now, in the private sector, when private companies nudge customers, one hopes that competition may, in some sense, mitigate that, because if company X is nudging you in one direction, company Y can nudge you in the opposite direction, and hopefully competition will. I'm not entirely sure competition will take care of it entirely, because I don't think we have strictly speaking, we don't live in a competitive world. There are any number of monopolies which impact our welfare quite adversely. So private companies nudging people towards good things, I'm not entirely sure, because you're being nudged into buying unhealthy things, you're being nudged into smoking, you're being nudged into doing a lot of sad stuff, right? So that could be that's something that I believe needs to be looked into. And because there is a market failure, I do believe that regulation is something that can address that ethical question of private sector nudging you, right? But now what about the government nudging you, right? Now, when a government nudges you, there is no competition. It's the only government that there is. I mean, you can, of course, vote the government out for having nudged you in a wrong way, but you're hostage for the period of time that it is nudging you. So what is the protective mechanism to insulate yourself from bad nudging by the government? And that's where I think legal institutions become paramount. You should be able to have a good court system which allows you to challenge the kind of nudging that is being done in society to lead you in a particular direction. And this is something that Cass Sunstein has written about extensively. He's a legal scholar and so on. You should read some of the stuff that he's written in this area. Let me pause there. Long answer to a very important question, but a great question.
Thank you, sir. So the next question is from Pavitra. She asks, how do you choose from the different methodologies, lab experiment and RCTs, with respect to the problem statement you are dealing with?
Great question. If you have the time, if you have the leisure, and if you have the money, you can do an RCT, right? But not everybody has the time or the leisure, or the resources to undertake RCTs. RCTs are great. I mean, it's a foundational innovation. What Abhijit Banerjee and Esther Duflo have done is remarkable. They've brought in a certain kind of a rigor with regard to establishing causation, and that is important. I think what they've done is important because it tells us that when we are spending our hard-earned tax money, we need to know that it is being used properly, right? So I buy that premise. But at the same time, the problem with RCTs is they're so damn slow at providing you answers. You go to a government officer, the government doesn't have the patience for. They need solutions now. In the long run, we are dead, as Keynes said, right? So how do you respond to people, who need answers immediately? That's a very, very, the rigors of RCTs are wonderful. They're great, but can we have an alternative system of discovery that can be more pragmatic and that can answer our questions, answer important and urgent questions in the short run? So one solution is to use lab in the field experiments. Lab in the field experiments are slightly different from field experiments. Field experiments, you're measuring real behavior. Lab in the field experiments, you're actually measuring behavioral outcomes. They might lead you up to intention to do something, but they don't actually measure the behavior itself. Lab in the field experiments are quicker. They still give you a causal purchase, a purchase of the causation between the intervention and the outcome variable that you're looking at, and they're fairly rigorous. So I would think that lab in the field is a very nice candidate to substitute for to substitute for field experiments in situations where you don't have the time or the money. The third alternative is qualitative work. I think qualitative work is seriously important in this work. I mean, this distinction, this artificial distinction that we have drawn between quantitative and qualitative is dubious. The quantitative people look at the qualitative people as if they're like, smoking weed and hugging trees and so on, and the qualitative people look at the quantitative people like they are Nazis. I mean, this mutual suspicion between these two camps is unwarranted. I think qualitative work can produce a really important knowledge. I mean, you go and have 10 conversations with people in a village, you learn a lot more than you would if you sometimes administer a survey which is very superficial. So there's a lot that one can learn from high valued quality. I think it's important to draw a distinction between high valued positivist qualitative work from dubious postmodern qualitative work. Right? I mean, qualitative work has in some measure been hijacked by postmoderns who deliberately engage in obscurantism. You need good scientific qualitative work, and a good scientific qualitative work can can give you a lot of insights, right? So depending on the situation, depending on the availability of resources, depending on your skills, you can find an appropriate methodology, an appropriate sample to go out and learn something. But the important thing is, all of us need to be scientists. All of us need to understand that the knowledge that we produce can be wrong, can be falsified, and that is a kind of a humility that we need to deliberately adopt in order to be scientific. If we are not deliberately humble, we stop being scientists and we start being religious or mystical even, which is not necessarily helpful in solving problems, right? So the exercise of humility, I think, is important. Whenever you use a method, whatever be that method, if you can say, these are the limitations of the methods that I have used, and I could be wrong. That's a very powerful thing to say. It's not a shameful thing to say, but it's a very powerful thing to say. Let me pause there.
Briti asks, have you worked in the education sector? What can be made of the findings with regard to the class and gender aspects of the society? How has the behavior of people with respect to their kids' education, especially from the marginalized section, changed post-pandemic?
I'm sorry, I haven't done any work in this area. I can't profess any wisdom in this. I think it's a very, very important area. I think it's a very, very important question to ask in terms of access. I would be worried about education moving completely online and on, marginalized communities and sections of society don't have internet. So are we excluding them? There is a high likelihood that we are excluding them, right? But have we gone and measured that? I don't know. I haven't done it, and I'd love to know if somebody has done that. And that's an important thing. That is a very, very important thing. So on one hand, I do believe that online education can be a very powerful instrument in democratizing education. I'm a great believer in the democratization of education. But can we make the infrastructure of the internet, can we make it available to the poor, to the dispossessed, to the marginalized, to the lower caste, to oppressed genders, and so on? That's an important thing. But we need empirics. And sadly, I mean, I, we would like to have the bandwidth to do that. We have the deep desire to do it, but we have finite resources to do it. And I'd welcome anybody who would want to come and work with us on that. There's this wonderful organization called the Central Square Foundation, which is founded by Ashish Dhawan, which does remarkable work in that space. I'm happy to put you in touch with that organization too. Maybe they have data, but I don't know of any, and I haven't done any work to profess any wisdom in that area.
So the next question Manat asked that we noticed during the second wave, Delhi people were criticizing the government for not stocking COVID resources and basic amenities like oxygen. Yet now these same people are flooding hill stations like Manali, etc., and roaming around without even wearing masks. Is it interesting to talk about this hypocritical behavior? Have we ever delved into such behavioral patterns?
I think calling that behavior hypocrisy is a bit strong, right? I mean, all of us exhibit inconsistent behavior. I mean, earlier I alluded to the principle of transitivity, right? It's a mathematical principle. A is greater than B and B is greater than C, and you would imagine that A is greater than C. But let's apply it in the case of how we like fruits. I like oranges more than mangoes and mangoes more than bananas, but it is conceivable that I like bananas more than oranges. And that's a form of inconsistency. It doesn't obey the principle of intransitivity. But would you call me a hypocrite for that? Would you call me, I mean, would you say that that is a bad thing? I think that's a bit of a harsh assessment of what people are doing. People are very, very tired of being indoors. Let's also be human about it, right? I mean, we are fundamentally social beings. We need to go out. We need to we need to be kind to ourselves. So I'm not quite sure I agree with such a harsh assessment of people. Yes, certainly, yes. I mean, you have a right to criticize the government, but at the same time, you also have a right to, do things um, which may subsequently be questioned in some measure, but to be assessed as being bad people and so on, I think is a bit immature. But that's my view.
So next question, Hariyasa asks, some business models based on economic democracy have thrived in different parts of the world. Broadly speaking, such models are cooperative rather than non-cooperative. Could such models be adapted in India?
Ooh, I don't think I understand the question too well. So the idea is that cooperative models have worked elsewhere and that they don't work here in India. Is that the question?
Yes, so I'll elaborate. That's my question. So what I meant to say is, in light of non-cooperative behavior that you were discussing earlier, so economic democracy based collectively, employees collectively own the stake in the company rather than a top-down corporate structure in which, among other problems, there could be a potential principal agent problem. And such models have been applied in different parts of the world and have been successful. So I wanted to ask, in terms of behavior research, could such models thrive here as well?
They could. I do believe that if you marry the the value of cooperation with the strengths of institutions, I think it can be a very powerful combination. The reason why I often believe that cooperative models may have failed in some parts of the world, maybe perhaps ours, in some measure, uh, is not on account of the fact that cooperative models by themselves are bad. I think it's on account of the fact that institutions are weak in some parts of the world, right? I mean, consider for a moment uh, the amount of time that it takes for a legal case to be settled in a country like India, right? And so In other words, an institution is weak because it's not able to deliver justice in time. So the lack of institutional responsiveness, quick responsiveness, leads us to depending on social norms and trust and so on, non-institutional mechanisms. So for instance, if I were a diamond merchant in Surat, right? The fact that I belong to a particular community will allow me to trust a fellow community member to enter into a contract, into an informal agreement, right? And that cooperative behavior is sustained by the fact that we both belong to the same caste, perhaps. But now, is it possible for me to enter into a similar relationship with somebody from Kerala? It does not. So in other words, my business opportunity is constrained by the fact that I'm depending only on trust, which is captured by small little caste groups, right? These are all responses to the failure of institutions in some sense, or the slowness of institutions. So one of the most powerful ideas that can be introduced in a country like ours is to liberate institutions from this the structural features which delay the delivery of justice, right? And there is actually an answer to that question. Why are our legal institutions so slow in delivering justice? It's primarily because the government is one of the biggest litigants in the country, and it clogs up the arteries of the legal system. It's not because we don't have enough judges. Now you might ask the question, why is the government one of the biggest litigants? It's because of the way government lawyers are incentivized. They are incentivized on the basis of the number of cases that they get into a court rather than the number of cases that they succeed at. So basically, you have clogged up the system, your institutions fails, and because your institutions fail, cooperation then becomes restricted to very small pockets, right? So that's my sort of broader answer to your question. So I still do think that the cooperative model can work, provided you can strengthen our institutions. You need stronger institutions for democracy to work better.
Now, so Shivanu asks, COVID has not only affected health infrastructure, but has also taken toll on mental state of each section in the society. How can we then include this in data valuation, as most of our measure lack any consideration of qualitative factors, let alone the mental state?
Yeah, yes, I'm with you on that. But now, can I mean, I don't, first of all, I don't have answers to all the questions, right? Can I ask a question in turn? How are we going to even start measuring that? How are you going to measure the detriment that is caused to our level of happiness? I know that there is a whole branch of economics of happiness and so on. They have some scales validated in some way and so on. But that's again an empirical question. To what extent have we been impacted in terms of our happiness, in terms of our mental well-being? I dare say hugely, but I don't have a number to tell you. I don't have empirical data to say that this is how much we were before COVID started and this is where we are now due to COVID. We don't have the data. And this is another reason why we need to invest in data, right? Provided we can measure it properly and so on and so forth. And these are all important things to measure. I mean, unless we are able to measure stuff in society, we're not doing, I mean, we're lacking the instruments. We're lacking the ability to change society. We need to be able to go out and measure. Unless you can measure, as Richard Feynman in physics would say, unless you can measure, you're no good at physics. You got to be able to measure stuff. So go out and measure stuff. Let us invest in measurement. Let's invest in data collection. Yeah, and mental health is a serious issue. I mean, it's not just people in general. I mean, I know people in particular who have been very badly affected by this. You wake up in the morning, feel anxious, right? Because your very fundamental human instincts have been, in some sense, been curtailed by this dystopian world, right? So
Yes.
I don't have the answer to that question in terms of measures, but I do think that it's an important question. Yeah.
Thank you, sir. So, Deepshika now asks, sir, how far do you think behavioral science can go in encouraging social behavior culture that is safe for women in reducing rapes?
Okay. I think it can help. uh, but are you going to? So let me reframe this question. Are you going to try and nudge a rapist out of being a rapist? I'm not very optimistic about that method, right? I again I come back to the issue of institutions. Do we have adequate institutions to protect women? Not just sort of on paper in the constitution and so on, but in terms of working operational structures. Let me give you an example. I mean, we did some work on domestic violence in Maharashtra. One of the fundamental reasons why, and then we started, doing work on the police and police filing cases against male perpetrators of violence against women. Now, why don't police officers file cases? They don't file as many cases as they should be. Every time a woman, who's been beaten up at home goes to a police station, guess what the reaction of the police officer is? The reaction of the police officer is to try and do counseling and try and go back to the family and continue living with the violent husband. Why? Because the social norm is to preserve the harmony of the family as against break the family, right? So we made a dirty word out of the word divorce, right? Now, so how do you break that norm? How do you get, so let's reduce this whole thing to a simple statement. How do you change the behavior of the police to get them to file more cases against male perpetrators of violence against their spouses, for instance? How do you do that? Now that would be a sort of a working question that you can think of. But again, here I'm not very, if I were a, a supremely powerful person in this country, I would not depend on behavioral nudging, oozy goozy soft stuff to try and fix rape in society. I think we need very powerful, trustworthy institutions. Listen, guys, I mean, behavior science is really cool. It's very accessible. It's nice. It's fun. It's sexy and all that. But behavior science is not the solution to all the fundamental problems in society, right? You need institutions. Far more powerful than behavior science is institutions, legal institutions. Law is the foundational pillar of a working democracy, of a working civic society, right? That's what I feel. So some serious, yeah, sure. I mean, you can change behaviors of people in a light touch manner using behavior science and so on, but the more heinous crimes against marginalized communities, against women, against other genders, etc. No, I would still rely on institutions. Sorry to
So,
disappoint you from a behavioral science point of view on that, but that's not something behavioral science can do
No problem, sir. It
adequately.
is the reality, so we can't,
Yes. Yes.
deny the reality.
so, Supraja asks, as an as an aspiring behavioral economist, how should one go about becoming a behavioral policymaker in India?
So first of all, okay, to become a policymaker in India, you need to go through the civil services. There's no alternative to it. However much you may resist the idea of going to the bureaucracy, ultimately, my practical advice to you is that the bureaucracy is a place from where you can produce immense change, right? Or alternatively, you can become a lawyer and become a judge, and then you can produce change. These are two very viable ways of producing change. Or you can become a politician and become, you know, a grand behavioral scientist king in a sort of a like a like a philosopher king. You can become a behavioral scientist king, to borrow a, an idea from Plato. uh, a good grinding in behavior science is, it would involve becoming good consumers of quantitative data, would become good consumers of empirical evidence, right? And if you can acquire these skills through graduate education or whatever, and then become or join the bureaucracy, that's a very powerful combination. And then not lose sight of why you're joining the bureaucracy as you go through your careers as bureaucrats, is the way to change society, right? So I would strongly encourage a lot more people to uh, a lot more economists in general, a lot more social scientists in general, to join the bureaucracy and to become analytical social scientists within the bureaucracy, and you can produce the change from within. I think that's important.
So could you share some like key behavioral insights that have emerged from studies in the realm of health and nutrition with respect to India?
So I can tell you a little about an experiment that we ran, yeah, related to complementary feeding. This is really something that we feel proud about, because I do sincerely and genuinely believe that our experimental results uh, have both qualities. On one hand, they speak about uh, the causal relationship between the intervention that we invented and the outcome. That's one. So there's strength there, and simultaneously, I also think that this is an idea that can be scaled up at low cost. So this is an experiment in which we basically formed groups of people, right? Of parents, into WhatsApp groups and moderated WhatsApp conversations, right? And we would, over a 2 weeks period, we had discussions about the benefits of complementary feeding, diet diversity, and so on and so forth. And we have some outstanding results in terms of the likelihood of people, complying with what are good practices from the point of view of diet diversity or complementary feeding. 1.6 times the likelihood, right? uh, with the treatment as against the control group and so on. Now, what is the kernel of the intervention that we used? We used the formation of a group. They were on WhatsApp, and the fact that they could access the conversation asynchronously, right? I mean, so for instance, so the one of the treatment groups we had involved making phone calls to people and giving them counseling, right? And that didn't work as well. Why? Because you could be making a phone call at a time when the person is not interested in speaking. The absorption capacity of that person when you call may not be very high. But in a sort of a WhatsApp kind of a group, you can access that conversation. You can join that conversation anytime that you want to. Right? It's not linear, it's non-linear in some sense. And that seemed to have worked very, very well. And second thing, of course, is the fact that you are within a group. The fact that you're within a group and that there is a potential for an adversarial interpretation of the information that is being passed on to the group, and a consensus of the group, normativity of a group, all these seem to have worked in enhancing the intention to comply with complementary feeding. So you can try techniques. So this is our big success story at CSBC, that we do believe we have found a very effective method of increasing complementary feeding as far as child nutrition. That's one of our big first successes. Yeah. We work on pretty serious problems. They're not often um, the the fancy problems that you encounter in nudge books.
Thank you, sir. So